brief synopsis of the problem presented here is the COVID-19 pandemic. Have any one of you guys actually had COVID? I know I have. I once had COVID, and I can actually confidently say that it has had a huge impact on my life in terms of my routine, the way I eat. It's just a huge adjustment to a change. We are definitely living in strange times. With that being said, the brief synopsis of the problem presented here is the COVID-19 pandemic and the impact that it has actually had on people's lives, livelihoods, the food systems, and health, of course. COVID-19 is a pandemic that has actually affected the international and domestic food supply chains, not to mention that it has completely wiped away so many people's jobs, forcing people to make adjustments to changes like how much you spend on food, on medication, and almost left so many people bankrupt and many businesses especially bankrupt. A solution-based framework called design thinking is a process that will be used throughout the video to create a problem statement to help eradicate the issue involved. Ideate, which is one of the steps of the design thinking process, will be discussed throughout the video on how it can actually help eradicate the COVID-19 pandemic issue, as well as a prototype of an app that has been created to also help solve the issue involved. With that being said, a solution-based framework known as the design thinking process is used to help eradicate this wicked problem. The ideate step, which forms part of the design thinking process in particular, is used to brainstorm and create solutions to help solve this eradicate problem. Part of this step is to also use secondary research as primary research to make the user relate to the wicked problem. That way, it will be easier to generate a problem statement to help effectively eradicate this issue. I present to you a brief synopsis of the problem at stake, which is the COVID-19 pandemic. The COVID-19 pandemic has had a huge impact on the livelihoods of people in terms of food, health, and living conditions of most citizens in the country. COVID-19 has shifted a lot of change in the country. It has negatively impacted especially the domestic and international food supply chains, and it has also contributed to a huge unemployment rate.
Hello everyone, my name is ATHENKOSI MABUSELA, and I will be talking about the third stage of the design thinking, which is ideation. Ideation is the creative process of design thinking where teams gather ideas, and the ideas are not mostly focused on the quality but mostly on the quantity of the ideas.
Design thinking is a solution-based framework, so the focus is on coming up with as many ideas as you can. The focus is bringing potential solutions as possible. The ideation phase is both a core design thinking principle and a step the design thinking process. This stage is a judge-free zone where the individuals are expected to come up with as many ideas, focusing mostly on the quantity of the ideas more than the quality of ideas. How might we meet the needs of people in less fortunate areas and give them the necessary resources? South Africa has a two-tiered and highly unequal healthcare system. The public sector is state-funded and caters the majority, 71% of population. In the less fortunate areas, the state of hospitals is very poor, resulting to deaths that could be easily avoided if the system paid full attention to the communities in our nation. The goal of this stage is finding a solution that will improve the state of the healthcare system in our poor areas. Ideation methods and 20 ideas. The problem at hand is the lack of resources in hospitals in the less fortunate areas, and the problem we're trying to solve is trying to gather ways in which we can improve that issue. Method number 1, brainstorm ideas. 1, we are trying to solve a problem, so expand on the meta. 2, who are we seeking help from? Collect data on the departments that will assist with improving the healthcare system in less fortunate areas. 3, set follow-up dates with the team to track of the progress during the process of solving the problem. 4, Find out from communities that need improvement. This will help us understand what we are trying to solve for the community and what the actual community needs. Method number 2, bundle ideas. Idea number 1, healthcare facilities without enough resources to seek financial assistance from government to help improve the state of hospitals. Number 2, employing more staff members. Number 3, create a trustworthy financial team that will monitor the use of the financial activities in the hospitals. Number 4, turn caregivers into allies. 5, prepare the clinical staff to work with caregivers. 6, create a culture of shared accountability. 7, understand how caregivers impact hospital image and reimbursement. 8, provide consistent quality patient care. 9, utilize NPS and PAS for staffing success. 10, look for patient care opportunities beyond the four walls. Example, post-acute care, telehealth, employee wellness program. This is to make sure that the employees are in good health so they can get good care of the patients. 11, make improving patients to experience an even higher priority. 12, ways to improve patient experience. 13, encourage effective communication in the healthcare management and in the teams that takes care of the patients. 14, have a team that takes care of the documents to keep track of activities or improvements. 15, promote productivity. 16, optimize standardization of care. 3 core design principles. Number 1, the service of improving the healthcare systems will connect us with the community. Number 2, the more healthcare employees, the better the service in hospitals. Number 3, if the health sector did a better job of acquiring the necessary resources from the community, the outcome would be better.
Hi, I am LIVHUWANI Makgatho, better known as DK, and I'm going to be discussing the solution we came up with to help solve the wicked problem, which is the COVID-19 pandemic. 34.9% of South Africa's population is unemployed, and this is due to a number of socio-economic issues. When the COVID-19 pandemic emerged, it had already found South Africa in a very dire situation. This would then mean that the problem the government has been struggling to tackle for years would become worse and people would lose their jobs in the process. So how do we stop that from happening? Or how do we come up with solutions to help tackle it when it does happen? The healthcare department was the most affected by the pandemic, for obvious reasons. In just a few months, there was an uncontrollable influx of patients filling up hospitals, both public and private. However, hospitals did not have the right amount of resources or healthcare workers to accommodate these patients. So how do we find a solution to this and essentially save lives? There is clearly a shortage of healthcare workers. This may be due to a lack of resources from the government or just lack of education and training from South Africans. Whatever it is, it does not change the fact that we do not have enough health workers in the country, and of course we can't exactly fix the problem within a year. So what do we do now with what we have? Working together with the government, we can formulate an accurate database that contains information of the number of people that are unemployed in the country. Once we have an accurate number, we can create an opportunity for South Africans that not only helps with the unemployment rate, but also the pandemic and saving lives. We can do this by commissioning hospitals all over the country to take in a certain percentage of unemployed peoples in the community and employ them as caregivers. The remuneration for these caregivers would be a substantial monthly stipend. This way, doctors and nurses can find it a lot better to maneuver around the influx of patients and can prioritize high-risk patients while patients with less risks are being taken care of by the caregivers.
Hello, my name is ANELISIWE, NKOMONDE, and today we'll be discussing the concept of prototyping and how the COVID-19 pandemic has caused those who are underprivileged to not have access to medical resources. In the next slide, we'll be discussing the concept of what prototyping is. When it comes to design thinking, coming up with an idea that is innovative, revolutionary, and world-changing and makes everyone happy is a good thing. However, producing these ideas without testing and validating them can potentially lead to failure. Being able to create a prototype and receive feedback can assist in discovering critical insights. The purpose of building prototype is to get an understanding of the reaction or the behavior towards that prototype that was created in order to help better the current situation by investigating the problem areas in depth and coming up with a resolution by designing new solutions. Here, we implement the idea of our prototype. The following will be a short description of our prototype. With the COVID-19 being the primary focus of our task, our main concept revolves around what we can do to solve the problem at hand, which is to provide the necessary resources to areas that are less fortunate. We have come up with a prototype, which includes the demonstration being in the form of an app. We use the high-fidelity wireframes to make a rough plan of what the app will include. The purpose of this creation is to have people in less fortunate areas be able to access medical facilities, and because some people do not have modes of transport, this app is used exclusively for COVID patients to offer them an emergency ride to the hospital, especially in critical conditions. The app asks you for your information details for registration, and as soon as your details are on the system, you can log in with the language of your choice. There are 8 different methods to consider when creating a prototype.
The 8 different prototypes are as follows: sketch prototypes, paper, clickable wireframe, Lego prototype, role-playing prototype, Wizard of Oz prototype, 3D prototype, and high-fidelity wireframes prototype.
The next point is testing. The reason for products being tested is to see if the product will function. Testing is the 5th phase of the design thinking. We presented this idea to some Vega students, and they agreed that the app could help better the issue at hand. However, there were some concerns on their end. The following questions are some of the feedback that was given. Will these areas have access to the app for free? Using Khayelitsha as an example, this entire area has access to free internet for 30 minutes per day, and so this can help them access the app. Not only that, every block has a designated building that works with our app, almost as a customer service representative, where we will hire professionals that can assist in signing in. While you are waiting, the patient will be tended to until the ambulance arrives for them, and in the ambulance on their way to the hospital, the patient will be tended to. To conclude, this task has given us a different perspective on how ideas can be complex and not just two-dimensional. We hope that our Remedy app assists with the problem. We named the app that because that is exactly what we want to be for people, their remedy.